May is Mental Health Awareness Month, and we are recognizing that this week on A Deeper Dive with Mike Watkins, the Chief Executive Officer of NWF Health Network, the agency that serves the 18-county region around the Florida capital. We'll be hearing all about mental health and substance abuse services. So stick with us. You don't want to miss it. Mike Watkins, a lot of you folks know him in the Tallahassee region. Happy to have him here to talk to us about Mental Health Awareness Month.
For every 4 counselors we need, there's only 1. So we have about 25% of the capacity in behavioral health professionals to respond to the need, to the identified need.
You're listening to A Deeper Dive with Dara, a podcast by the News Service of Florida.
Back in the terracotta room today with another one of my OGs, Mike Watkins. He is the Chief Executive Officer of Northwest Florida Health Network. Is it NWF Health Network or is it Northwest Florida Health Network?
It's in fact NWF Health Network.
So do I need to redo that?
No,
Mike Watkins, CEO of NWF Health Network. I just thought maybe some people might not, if you're not in NWF, you might not know IRL what it is.
It's one of our favorite things to debate internally about how we pronounce our name. Yes.
Yeah, and you already did a rebrand. What? Not how long ago was the rebrand?
We did 4 or 5 years ago.
Okay.
When we started serving the Pensacola market. We have 18 counties from Pensacola.
Well, let me ask you what we got. Mike Watkins, and very excited to have him here in the terracotta room. As I said, tell us a little bit for people who don't know what your agency does.
Well, we've been asked by the state of Florida to particularly take care of acute populations. The way that we define that is that folks that are either at risk of abuse and neglect, child abuse and neglect, or whether they are subject to substance abuse issues or mental health issues, we're really the managed care layer to make sure that all the state and federal funds are used in a way that best meets the community's needs for people that are in those conditions. So specifically, we're responsible for all of those folks between Pensacola and Perry. So that's 18 counties. It's a lot of folks. It's about 1.6 million population. Mm-hmm. And on any given year, we're going to serve 65,000 unique clients.
And so you're kind of the umbrella agency, right? So you don't directly provide services to clients. You deal with the agencies that are the direct service organizations.
Yes, almost entirely we are subcontracted. So we are working with folks like Appalachia Center and Life Management Center. And,
here in Tallahassee,
yes.
Appalachia. And one of the reasons why I'm really delighted to have you with me today isn't just because I haven't seen you in a minute, but this is Mental Health Awareness Month. Did I get that wrong too? Or
you got it right.
So, as somebody whose mother committed suicide when I was quite young, I am very cognizant of these issues. And I have to say, I'm really glad that we're talking about mental health wellness more than we used to, because there was so much stigma around mental health. And that's one of the questions that I want to talk to you about. Let's just start with that. We have a Mental Health Awareness Month now. Have we seen a lot of the stigma dissipate around people with mental? Because it really affects people and communities. We're talking about it more. People are urging people to seek help more. We've got a national suicide prevention hotline. I think that's 211, right?
Yes.
So let me stop asking and let you answer that question.
Yeah, I think, the younger generations, each generation, there seems to be less and less stigma. So in our, Western society here in the United States, and particularly in Florida, in the Panhandle, I think there's been much improvement over just recognizing what the issues are and trying to respond to that in a way that is healthy. Every one of us has struggles. In fact, one of the best lines I've heard from the First Lady is, it's not a matter of if you will have issues that you face in your life, it's a matter of when, which I totally subscribe to. We're all going to have that challenge at some point in our life. So we're really trying to build resilience through awareness of what these issues are, how to respond to that when they occur, how do you get support from other people when you need that help. And all of that stuff is in play in mental health awareness so that we can make sure all the way from our youth to our elderly, which is a growing population, as you know, understand where to turn
Having
to.
already many years ago gotten that AARP card in the mail.
Yeah, it's
the minute you turn 50, I think the year before you turn 50, they start reaching out to you.
No one's immune to it. So I've got 4 girls, and so they're 26, 18, 15, and 10. And
right.
What we like to say is that happiness or sadness comes from your surroundings mostly. Those are like environmental issues. Is today a good day? Is today a bad day? But that joy that you can call it whatever you want to call it. We call it joy in our household. That comes from within, and we think that's God-given. But your circumstances can vary from day to day. And what are you going to do about that when you do face those challenges?
Have you seen an increase in demand for services? How long you've been there for quite a while as CEO
This is my 34th year in the business, and I've been CEO for 19 years.
Okay, wow.
Yes, ma'am. And I will just tell you that we are seeing steep increases, particularly in our youth, around episodes of psychosis, certainly increased diagnosis, increase calls to hotlines, et cetera. So I have some thoughts on that anecdotally.
I want to know because I'm curious, are more people experiencing more mental health or anxiety or distress? Are more people in distress, or are they now more willing to seek assistance?
Yeah, I think the answer is yes. I think both are occurring. Certainly it's a different world. So, when I was in school, we did not have, personal electronic devices. Now we do. So that rate of connectivity is, like most things, there's a plus side and there's a negative side. And we know through documented research that that it drives anxiety. Anxiety is a huge marker for psychosis. That doesn't mean that devices are evil and you're guaranteed to have mental health problems. I think what it means is there's going to be opportunities in today's changing world that is a little faster paced, and we have these anxiety opportunities that are presenting themselves. On the same hand, we also are openly talking about, hey, do you want to talk about these things? Do you know that it's, there's help for these kinds of situations that our youth are facing and our adults are facing?
Yeah, there was something that I was listening to a podcast the other day, and there was a therapist who was talking about something, and it was a phrase that I had never heard before, but it was kind of like normal is prevalence inflation. And I was kind of, it seemed intriguing to me. Are we seeing more, or are we aware of more? That's so. Is more happening, or are we just aware of more? And I guess what you're saying is both. And we have heard a lot of talk. We've talked about it on the podcast before about the impact of technology on particularly the developing mind, the developing brain, and the kind of pressure that kids are under to fill in the blank, be this, that, and the other, and being bullied and whatever. And so what is the data telling you about what kids are experiencing right now?
Well, the data is basically saying that since 2015, there's been a high prevalence, to use your word, of personal devices. Smartphones became widely used, post 2015. We've been through a natural or a pandemic since then, so that was an aggravating factor. More kids were out of school, more downtime, all of those things in our community. You're sitting in front of two devices right now. You have your desktop screen and you have your iPhone or your cell phone in front of you.
Well, I also have my watch on.
You have your Apple Watch. So,
right.
We talked recently about some of the research from, Dr. Jonathan Haidt, who's a social psychologist. And,
yep.
You're getting this input from multiple devices. And we know that that's impacting our younger people, particularly teen girls. And his research is focused on that. And we've been looking at that very closely. We're trying to insert, strategies to combat that a bit. You've seen the governor and the House and the Senate, pass, I think it was House Bill 3, to try to put some guardrails around, devices and particular applications for social media. So not to get too deep into that, I think there's attempts, to try to regulate this activity, particularly for our young folks. So we're paying attention to that. We also know that it's a very powerful tool for folks, and we have provided AI chatbots that are proven tools that our youth can access at no cost. So when they want to talk to somebody, they're able to do so.
You're using that now in the 18 county area?
Yes, ma'am. That's available widely.
Okay, so how does that work?
Yeah, the basic application is that our young folks can, or anyone for that matter, adults, can talk to this, clinically proving device where they can say, hey, I'm feeling lonely, or I'm not feeling
from
good.
Their phone.
From their phone, and it instantaneously responds to them with information and or an ongoing dialogue. So we know that one of the major elements of psychosis is loneliness. So this offers that opportunity when you can't reach your mom or dad, or you can't reach your best friend, or you can't reach a teacher. At any time of day, 24/7, at no cost, you can talk to this, to this chatbot. Now, there's some things that we've done to make sure, for safety reasons, that's being managed. One is that any harmful words that would be harmful to themselves or others, you're going to be sent to a hotline.
A real person.
A real person.
Right?
And, you may not like that, but that's part of the terms and conditions, that if you say you're going to hurt yourself or others, it's going to be referred to a hotline. In this particular case, we partner with Appalachia Center and Dr. Jay Reeve, where they're able to either communicate with that person immediately and or through law enforcement if it's a threat of harm.
Wow.
And then before that, even if you just want to talk to a live human being, you have that option inside of the messaging to say, hey, I want to talk to a real counselor.
Right. Do we have any numbers on the uptake on those?
We do. We have enough capacity to serve. We particularly targeted 7th through 12th graders. So we bought enough usage, if you will, bandwidth to respond to about 100,000 of our students, 7th through 12th, if you look at the 18 county area. And we've been running tens of thousands of kids that are using this service. Mm-hmm. And we've had a handful of incidents where we've had to respond with, live counselors and or crisis counseling, mm-hmm. Which was positive, that we were able to get to them and create that access point.
Did what it really was designed to do, right? Identify the people in crisis. I mean, not only to provide services, but be able to identify somebody who's in crisis and needs immediate assistance.
Right. And, I know you appreciate this because you live here. When you look at 18 counties across Northwest Florida,
yeah,
there's some corners of the the region of the Panhandle that are hard to get to, and I'm a product of that. I grew up in Washington County, and there wasn't a child psychologist or a psychiatrist next door. So if you're in Steinhatchee or Two Egg or East Point, you may not have the ability to go see a live counselor next door.
Go see Dr. Paul like I did for years right down the street. Shout out to Dr. Paul, by the way. Yeah.
Yes, ma'am. In fact, we know nationally that that's the case, that there's about one counselor where we need for every 4 counselors we need, there's only one. So we have about 25% of the capacity in behavioral health professionals to respond to the identified need. So you talk about that prevalence of inflation, I think is the term that you use, prevalence inflation. So we are going to have to catch up on the behavioral health side, particularly in the psychiatry and the psychology, the clinical disciplines. We're really going to have to catch up on that. On the licensed mental health counselors, and there's also a dearth there. So we are aware of that. We're trying to provide access points that regardless of where you are, that we're able to connect you to a helper.
So workforce issues, this is something that was a major priority, healthcare workforce issues, major priority of the Senate President Pasadomo. She also has been a guest on the show talking about her priority.
Absolutely, and I will point out 2 forms that we see that manifest itself here in the Panhandle. One is that you need all of the nursing care for residential facilities. So, Bay-Crack facilities, detox facilities, just residential treatment, all of the things that are, mind-related behavioral health hospitalizations. We need those folks, including the doctors. We need to be growing them because it takes a long time to grow that professional capacity. That's one. Another is, your outpatient counselors. We need to grow those. So along with Senate President Pasadomo and others, I know that there was legislation passed, and it was just celebrated yesterday, I think, by Representative Jennifer Kennedy. I had tweeted about that or X'd about that, where they are creating behavioral health programs inside of, I think this particular project was with the University of South Florida, which is a real commitment of resources and prioritization to try to grow that discipline.
Yeah, I mean, if we're seeing these kinds of shortages all over, I'd imagine that would be exacerbated in areas like Washington County and some of these more rural areas of Florida, harder to attract workers to those, pretty remote areas, and they don't have a lot. I don't want to disparage our rural communities. I love Florida. I've spent almost all my life here, so I'm not going to, I'm not dissing small towns. I just think that I know they have struggle.
With fewer people, there's fewer, disciplines, if you will, that are there. So whether it be dentistry or orthopedics or whatever the discipline is, we just have fewer of them as you get across the Panhandle into some of the lesser populated areas. And one of our goals at NWF is to increase those access points wherever possible for those that are in need.
So how much of a role is telehealth playing in all that?
Huge. Telehealth is huge. We have a 24/7 phone line for that. So in addition to the newer technology of being able to text, we also have the regular old phone that you can call someone if you need to talk to someone and get counseling.
How much of your contractors are they using, doing therapeutic treatment using telehealth?
It's been a huge increase, particularly I feel like the COVID pandemic forced us into that mode of operation. I mean, I'm guessing that your listeners and you and I have had more Zoom calls or Teams calls or Google meetings. We've had more of those than we ever had before COVID.
I think it's become normalized because of the pandemic, right? Now I expect to do a Zoom rather than a phone call. First of all, I like Zoom better. I was telling you, I like it. I like to be able to see someone's faces, certainly in a therapeutic setting. you want to be able to see someone's body language. I'm not a therapist, but I have been in the room a lot. So, right? I mean, that's something that you need.
And one of the things we're finding in the emerging research is that our young people actually prefer, there's some form of anonymity by being on your device. They're comfortable with their device, so I think this generation is much more accepting of having the conversation on their device.
They're much less accepting of doing stuff IRL, is my understanding, based on what Jonathan Haidt says. Right? Like they are much more comfortable on their devices than they are in the room with someone.
Absolutely, which is another whole issue about developing social skills.
So let me ask you a personal question. You have daughters. You have 4 financial black holes, I think I told you the other day. Yes. You have daughters ranging in age. What do you do about their screen time? You have a 10-year-old and a 15. Did you say 15 or
26, 18, 15, and 10?
15 and 10. So 15, 18 and 26. Forget it. You don't
I
have
had my
any,
shot.
Right, you're done. But 15 and 10. What do you do?
Yeah, this is an ongoing debate in our household. So we have gone through all of the time restriction capacity on the devices. We've gone from limiting apps being downloaded onto their devices. We have there's a downtime function where you can just say these are just hours that are not available to you to use your phone. So we've done that. Typically, they have been, whether it's right or wrong, this is kind of the path that Chris and I have gone down. Is we can tie that as almost a penalty. If they didn't do something or their grades aren't where they're supposed to be, then they lose access to certain things.
I wanted to talk about the First Lady. This is mental health awareness and has been a priority of hers. So talk about what First Lady Casey DeSantis is doing, and I saw you were at an event with her and the governor recently. So tell us what's going on.
Well, she's been very committed to youth issues and particularly around mental health issues. So I think it's certainly fair to say that she's been a champion of that. So in our role at NWF Health Network, we're a contractor for the Department of Children and Families, and specifically Secretary Siobhan Harris has been a great cheerleader, for this area. And so about a year ago, we were at FSU for a press conference, particularly around resiliency in schools. And she was promoting this idea that we need to have resiliency for all children, yes, for everyone. That's where I heard the quote of, it's not a matter of if it's going to happen, but when it's going to happen. Mm-hmm. And so we took that to heart, and we worked with the Florida Certification Board and Neil McGarry and his group. And
I know Neil. Yeah. I was Neil's tutor when he was struggling with a math class at FSU. So shout out to Neil McGarry. Yeah.
So
he's a great guy.
He's a great guy, and of course, they certify our child protection workers statewide, for investigators and case managers. And of course, that's gone national now. So, we're leading the pack on so many things in Florida. In this particular instance, I was able to talk him into creating a certification for resilience. So if you want to be a resilience mentor, resilience coach in the schools or in the community, we think there should be some standards around that to protect the public, to protect our kids, and to say, hey, here's some real science and some real tools around how you can promote resilience.
What is it?
Resilience?
Yes.
I think it's, how do you take challenges in your life? Resistance is
coping.
And how do you cope with that? Because I think if you were to say to someone, well, how do you get better? How do you get faster, stronger? We have all of these, sports programs in school. And we say, well, how do you get better, faster, and
how do you do your SATs?
You have to have resilience, and resistance. I'm sorry, resistance. Okay. And I think without resistance, you don't get better. And life, that's just kind of the way life is. So, from a mental health, emotional, social well-being standpoint, I think, understanding that you're going to have hurdles, And we would like for those to be small hurdles. Remember, I'm a dad, with 4 girls.
Right.
We would like for those to be small hurdles that are easily, able to jump over. But I think there is consensus that you need that practice. You need to know that when that barrier comes before you, that you can get, that you're going to get beyond that.
So life is going to hurt, but you can get through it.
Yes, ma'am. And then I'll just tell you that I don't think there's growth without resistance. I think it's a necessary component. I think to take that away from someone is to rob them of their opportunity to be their best version.
We have a new email address, and we'd love to hear from you. To reach us and give us your input, tell us what you'd like to hear. Tell us what you thought about what you already heard. Tell us how fabulous we are. Join the Deeper Divas team. Send an email to podcasts@e.newsserviceflorida.com. That's podcasts@e.newsserviceflorida.com. And I promise I will read everyone. What types of services are you seeing an increase in need for? Are they residential? Are they substance abuse? I have a sense I know what your answer is going to be. Are they mental health related? What is the increase in services that you're experiencing in the Panhandle?
Huge needs in substance abuse service intervention. Obviously, that is being positively affected with the opioid dollars, both from the federal government and from the settlements from Attorney General Moody's settlement. So those resources are just starting to get in play and actually making their way to the counties for deployment. And what we know is that it's very community specific. So across the Panhandle in particular, we kind of have 2 fronts. We have in the rural communities, we have a high incidence of methamphetamine use, illegal methamphetamine use, of course. And then we have a high incident of opioids in our kind of coastal communities in our cities. So maybe wouldn't use the term metro, but Tallahassee, Panama City, Fort Walton Beach, Pensacola.
More densely populated areas.
In the more densely populated areas, we are seeing much more opioid usage and overdoses.
Even now, with all that the state has done to combat, make it harder to get pain medication and shut down the pill mills and everything. So these are probably synthetic. They're not people going to a pill mill, but they're coming in from somewhere, right?
I think the last number I saw statewide was a 19% reduction in overdoses statewide on opioids, but there's still a high number of overdoses. So particularly the governor and the Department of Children and Families has pursued what they call a CORE program. So there's 16 counties across the state where there's an opioid response that's very specific on opioid response when people show up.
I think Pinellas County is one of those. They have
So for us, it's Gulf and Escambia are the original 2 counties. We're just now bringing up Leon, Okaloosa, and Bay. So as those additional counties come up, it's really an enhancement to make sure that the resources for intervention for opioids is better and the treatment is better. More rigorous, more of it. So we are working with the counties directly to put those dollars to work.
We've seen a lot of, it's a very vulnerable population, and we've seen a lot of exploitation of them in these sober homes and these residential, these like sort of halfway houses or whatever down in South Florida in particular. I know Dave Ehrenberg's state attorney down in Palm Beach County, and that's been one of his major issues is trying to shut those bad actors down.
But you mentioned specifically, the pressure on the legal prescription of drugs. That I think has been wildly successful in terms of managing that the prescription use,
reducing. Yeah, right.
But then the problem is for the true addict is
here comes heroin. Here comes fentanyl.
They're going to the illegal markets,
right.
And then it's not regulated and they don't know what they're taking. So what we're seeing is that, professional addicts, lifelong heroin addicts are overdosing and dying because they're getting fentanyl.
Right.
And it's so powerful and people are dying from it.
And they don't know that if fentanyl is laced in the products that they're getting or...
Right. In fact, it's all product, right? So it doesn't matter if you're buying whatever pill you're buying, whatever marijuana you're buying, you may think it's one thing and it's something else.
Well, we had recently, I mean, not that recently, but it was either Gadsden County or Jefferson County when they had a bunch of overdoses.
Yeah, so July 4th will be 2 years. And this is a horrific, tragic incident where, law enforcement referred to it as a hot batch. So there was some drugs being sold, particularly in Gadsden County, and I think we ended up with 9 deaths. So in that particular case, both the governor and the first lady, as well as NWF Health and DCF, we all responded to Gadsden County. It was on a 4th of July weekend.
Wow. I remember.
And Sheriff Morris Young was, rightfully disturbed by this, mass loss of life in Gadsden County, rural Gadsden County. They had not had a reported fentanyl death in Gadsden County up to that point.
Oh, really? I didn't know that.
So we immediately went out with a prevention campaign, as one of the strategies to say, hey, one pill can kill. You should not be taking this stuff. You don't know what's in it. So that was one strategy. We also, brought them and made sure they had equipped all their law enforcement officers with life-saving Narcan, for revival if necessary. And remember now, this is a county that had not had opioid overdoses.
Right.
So,
it was really a shocker.
Infuse those resources. There's also a database has been used in some of the larger sheriff's offices that was for overdose tracking, so that we could map out any overdoses that are reported.
Hotspots.
Yes, ma'am. So they got included into that software, and knock on wood, we have not had a like event since that time.
Right. I mean, you hear about the use of Narcan in some places where some locations the EMTs are going numerous times to the same household in the same day. People, they come to, I mean, it's a miraculous drug, right? They come to, they start using again, and if it's bad, it's bad. It's not going to get better because you OD'd and came to. I mean, it's just it is still something that we are struggling with.
Yeah, it speaks to the tragic nature and addiction of this
something
drug.
I know a lot about.
And we don't have it solved. I do think that the core programs that the governor and the Department of Children and Family is pursuing has been effective. We're trying to increase more counties to have a full array of services to respond to opioid overdoses. I think all of the county, officials are trying to figure out how to best use the settlement dollars,
right?
To deal with it.
It's a pile of money.
It is, but it's also a huge problem and challenge to try to overcome because
right,
addiction
and
is
it's
so
their
powerful.
fault. I mean, they did this knowingly, marketed these drugs in a very, in purposefully to get people addicted to them.
Yeah, I think we can agree it was, it was an awful,
horrendous,
thing to do. So it does bring up a thought that here in the Panhandle that we're extremely reliant on our sheriffs across the Panhandle. And one of the things that NWF does that's pretty unique across the state of Florida is that we are contracting directly with the sheriff's offices across the Panhandle. And we're doing so kind of on a two-prong approach. One is to be there to be the bridge for this 59 minutes for mobile response team that we talked about earlier. So they are recognizing through their training and through their role that they play pivotal piece of getting that person, make sure they're safe until the Appalachian centers of the world can show up and take care of that person. The other piece is through community outreach. What we know, and I think, Sheriff A.J. Smith and, Sheriff Young and Sheriff Tommy Ford, they would all tell you that a lot of criminality is really a symptom of behavioral health or substance abuse.
So I'm curious. So you're saying the drug settlement money you're wanting is being steered in some instances to the sheriffs?
No, it's not related to the settlement dollars.
You're working with them though as part of these response teams. Mike, I wonder, does that raise issues? I mean, it must take a lot of training because law enforcement, people are afraid. People, particularly if you're engaged in illegal behavior using illegal drugs, you're a lot of times when you're using illegal drugs, there's other illegal activity that is associated with that, right?
So that is the paradigm. That's exactly the paradigm that we're facing, is that these folks are already standing in front of a law enforcement officer. And so what we've been effectively able to do with the sheriff's offices, and most of we do have some police departments that we're working with, but most of our counties are rural, and the institution is a sheriff. So what we've done is we've said, okay, in those cases, oftentimes what they report to us, it was their response is that we can lock them up, and we do. When people are breaking the law, that's what we do. We lock them up. But we're seeing the same people over and over and over. They need some kind of intervention, or someone in their family needs intervention. So I cannot tell you how many times a sheriff has said to me that the calls that they struggle with the most and they just don't have a good answer for is when a mama or our dad or an aunt or a grandma says, my kid, and oftentimes adult kids, my kid is doing this and I don't know what to do. So,
okay, well, I'm going to cry.
Yeah.
When you have a kid who's a kid and they're an adult, if they're 18, you can't, there is no book that says if they start using this drug, you do that. You want that book. It's really hard to know what the right thing to do is. It's very frustrating. It's very scary. It's very sad. It's like cutting yourself with stones.
It is, and it's very personal. And again, as a father, I live that every day. And what I would tell you is that I can only tell you from my own testimony that hundreds and thousands of people across the Panhandle have been provided coordination and outreach to try to get them connected to a resource so that they can address this issue. Now,
you were saying the sheriff comes to you like, I've got the mom, I've got the dad, I've got the relative, they want help. What does the sheriff tell them? Who do they, what do they do?
So we've been funding, not through settlement dollars, but through our community outreach dollars, a position in particularly these rural counties. So Tallahassee, there are behavioral health resources here. There's,
we're a metro.
We have, 211, and there's so many ways to get, there's more access. Okay. So when you're in the rural counties, particularly is where we're funding the community outreach, because we know the intersection between criminal justice and behavioral health is huge. Most people that are intersecting the criminal justice system have a behavioral health issue.
Yep.
And so what we're saying is somebody that's on the team that's wearing the shirt, not carrying a gun, wearing the golf shirt, the polo, and they're saying they're part of that sheriff's department, and they're saying if you need residential treatment, we're going to hand walk you through that.
Okay, so they're not showing up with a gun and a holster, and that's what I'm saying. That was my initial reaction was what? Right.
I think the real scenario is law enforcement is on the scene. They recognize that, the criminality part is going to take care of itself, but there's this whole other aspect that needs to be addressed, or we're just kidding ourselves. And that's where we're able to connect people to the resource for behavioral health. Now, I've heard you mentioned I was at a press conference with the governor and First Lady, and Eric Dellenbeck, who's the faith liaison for the governor. And the words that they use is that we don't have a resource problem in Florida. We have a connectivity issue in Florida. So with Care Portal and our faith community, let's just start with a soft service. Like if you need a child, a car seat, or if you need help with rent, or if you don't have bedding, which we just went through, by the way, with the storms. We have people that have those kinds of needs. Connecting the faith community and people in need is a huge opportunity for us to do so on a greater order where people aren't going without. So we're doing that. We're working very hard at that, and that's what the press conference was in Panama City Beach about. Now, at that next layer where I need counseling or I need a residential program, that's where we're working with the sheriff's department to say, okay, how can I get this person a proper assessment and get them the proper resources? Now, that does not guarantee that we're going to fix an addiction or we're going to get rid of an addiction or manage the addiction, but it certainly gives us a greater opportunity to try to meet that need.
And you're able to, I was going to ask you, what is the greatest need right now? What is the greatest unmet need? Do you have the manpower to do those assessments and to provide those services once you assess? It's all well and good if you say, okay, this person needs XYZ, but you don't have XYZ to offer them.
We do. I think there's always a resource challenge, but we are meeting the need. There's not anybody that's waiting on a service per se. We are intervening with them, through outpatient counseling and in some cases inpatient counseling. I think one of the areas that we've identified as being a challenge, and I can give you two examples, is that Sheriff Tommy Ford in Bay County got a special appropriation this year so that part of his jail can be a treatment facility. For
inmates?
For addiction, yes, ma'am. So here's
That's
persons.
terrific.
Yeah, so here's persons that are already in jail. Obviously, I think it'd be voluntarily. They would say, they raise their hand and say,
Right.
I want the treatment.
Right.
But he's able to bring that resources into the facility while they are incarcerated. And I think that speaks to a specialty need. You're talking about a small number of the population that's in jail, and then of those people that need treatment while they're in jail. So as that resources becomes available, I think there's more need for that across the Panhandle. And probably across, the United States, frankly. But that's the kind of thing where the legislature has recognized, okay, we're going to make this investment at scale, and we're going to try to make sure these people aren't coming back. Because the reason why we lose property and lose people through criminality is because of this underlying issue around mental health and addiction.
Okay, before we say goodbye to Mike Watkins, CEO of NWF Health Network, we're going to provide a couple of numbers for the community. These are only for the 18 county area for NWF, for the mobile response teams, for somebody who's in immediate crisis. That number is 850-523-3248. For counseling, that's 800-354-9308. And for that chatbot, and this is really for people not to fool around with, this is for people who have a genuine need for this, it's 850-801-6119. Mike Watkins, it's been a pleasure chatting with you about what you're doing to help people in need, in crisis, and in need in Northwest Florida. Thank you so much for joining me today.
Thank you for having me.
You're listening to A Deeper Dive with Dara, a podcast by the News Service of Florida.